This is my student support system. Keep watching, keep learning.
Pathophysiology of pain. Pain experience involves activity of nociceptors. Nociceptors are neuronal receptors involved in the transmission of pain to and from the brain that respond to biochemical mediators or noxious stimuli. Nociceptors are free nerve endings which are situated in the skin and they respond only to intense, potentially damaging stimuli. Such stimuli may be mechanical, thermal, or chemical in nature. When these fibers are stimulated, histamine is released from the mast cells, causing vasodilation. The cutaneous nerve fibers further branch and communicate with the paravertebral sympathetic chain of the nervous system and with large internal organs. As a result of the connection among these nerve fibers, pain is often accompanied by vasomotor, autonomic, and visceral effects. Nociception continues from the spinal cord to the reticular formation, thalamus, limbic system, and then cerebral cortex. The involvement of reticular formation, limbic and reticular activating system, the which is the responsible for the individual variation of the perception of pain, because same pain may be perceived differently by different individuals. The descending control system is a system of fibers that originate in the lower and mid portion of brain and terminate on the inhibitory interneural fibers in the dorsal horn of spinal cord. This system is always active. It prevents continuous transmission of painful stimuli partially through the action of endorphins. Cognitive process may stimulate endorphin production in the descending control system. There is gate control theory of the pain described by Melzack and Wall in 1965. This theory proposed that the stimulation of skin evokes nerve impulses that are then transmitted by three systems located in the spinal cord: the substantia gelatinosa, the dorsal column fibers, and the central transmission cells. The noxious impulses are influenced by gating mechanism. Stimulation of large diameter fibers inhibit the transmission of pain, thus closing the gate. And conversely, when smaller fibers are stimulated, the gate is opened. The factors which affect pain response include past experience with the pain, anxiety, culture, age, gender, genetics, and expectation about pain relief, etc. These factors may increase or decrease perception of pain. Past experience. The people who have had multiple or prolonged experiences with the pain will be less anxious and more tolerant to the pain than those who have little experience. However, individual variations may be there. Anxiety and depression. Anxiety that is relevant or related to pain may increase the patient's perception of pain. Anxiety that is unrelated to the pain may distract the patient and may actually decrease the perception of pain. Culture. Understanding about pain and how to respond it is differ from one culture to another. Early in childhood, people learn from those around them what response to the pain is acceptable or unacceptable. Aging. A gradual reduction in endoneuronal blood flow with increasing age, which may contribute to reduced peripheral nerve function and diminished pain perception. Old age people are reluctant to seek help even when they are in severe pain because they consider pain as part of normal aging.
My student support system. Keep watching, keep learning.